My name is Simon Wilkinson and I'm the Chief Executive Officer of Innate Immunotherapeutics. We're a New Zealand-based company, but our private shareholders come from the United States, Australia and New Zealand. Our shareholders have invested over $40 million in the business over the last 12 years. And we're in the business of developing a new drug for multiple sclerosis. 85% of patients, when they're first diagnosed with MS, have a relapsing remitting form of the disease. During this phase, the patients experience acute attacks that will leave them with neurological damage, and that damage either partially or fully repairs. They'll then go through a period of remission, hence the name relapsing remitting. Right now these patients have got 8 drugs approved to treat their relapsing remitting condition. Unfortunately, despite those drugs, over 2/3 of these patients go on to develop a progressive form of the disease. These patients have no drugs that are effective to treat them. We have a drug called MIS416, which is showing great promise for treating secondary progressive MS patients. The drug has been in patients with this type of MS now for just under 4 years. During the first 2 years, we treated patients under a compassionate use program, something that's allowed here in New Zealand. In the last 2 years, we've been treating different patients, but under the setting of a controlled clinical study. We've just announced the interim results of that study, and we're very excited to say that in over half of the patients treated, there were significant improvements in a range of their MS-related symptoms and disabilities. The drug has shown clear safety, but much more importantly than that, the drug has brought about a significant improvement in most of these patients. Over half of the patients have had a significant increase in their cognitive ability. You can imagine how excited the patients are themselves. And the majority of these patients have now finished on the study but want to continue to be treated with our drug, and so they'll be coming across into our compassionate access program. So where to from here? We now need to run a larger study in more patients over a longer period of time. We're going to run that study in Australia starting in 2013 with an aim to finish it in 2014. Designing this study is going to be a really interesting exercise because most MS studies are about slowing the rate of progression. Our study is going to look at improvement in these patients, and that type of study hasn't been run before. To help design that study, 3 of the major pharmaceutical companies, as well as representatives from the National MS Society in the United States, are providing experts for us to help design the study. The Multiple Sclerosis Society has already part-funded our existing study, and so their continuing support and the support of the pharma experts is very important to us, and we think clearly validates that this drug has an exciting future. If the next trial goes well, we'll be looking to license or sell the drug to one of those large pharmaceutical companies in 2015. So we hope that you've found the details of interest, and we very much thank you for your attention today.